SickKids Hospital is certainly dealing with that surge of patients. In fact, it is cutting back on non-emergency surgeries to deal with the overwhelming surge. The hospital says it has no choice but to reduce surgical activity temporarily to preserve critical care capacity. SickKids has been at 127% capacity in the ICU for several days now, and more than half of those patients are currently on a ventilator. In addition, other Toronto area hospitals have also reached maximum capacity, and SickKids is now helping those hospitals virtually to care for pediatric patients. For more on this troubling situation, I'm joined by Dr. Ronald Cohn, the president and CEO of SickKids Hospital. Dr. Cohn, thanks so much for making time for us this afternoon.
Thank you, Beatrice, for having me.
There is a lot to unpack here. I want to start by asking you about what we're hearing that Dr. Kieran Moore on Monday is going to be recommending people wear masks to help the pressure specifically on kids' hospitals. It is a recommendation, not a mandate. Should it be a mandate, doctor?
So I think we need to, and I would like to speak to all of your listeners, to really do three things. Number one, please, everybody go out and get your influenza flu shot as well as your COVID booster shot. And please mask indoors, particularly indoors in indoors crowded places. As well as don't see anybody in your social circles or family if you are ill and sick. And we would certainly support the universal masking at this point, given the situation we are in. But I think, let me quote Nelson Mandela for you for a minute. There cannot be no keener revelation of a society's soul in the way in which it treats its children. I think we can all do the right thing here. Get vaccinated, wear a mask, and please stay home when you're ill.
Would you prefer, Dr. Cohn, that this was a mask mandate coming on Monday to alleviate the pressure on your hospital and others across the province who are really struggling right now?
We are really seeing these pressures all across the province, and we would certainly support a universal masking mandate.
As SickKids is a beacon of hope for families in this city and those right across the country, your staff do heroes' work each and every day. It sounds like, though, we are in an unprecedented crisis. So help us, doctor, understand what is going on and why are so many kids sick right now?
So we are really seeing a multiple number of different viruses that affect the respiratory system, infecting children right now. And we are just at the beginning of the RSV and influenza season. And that leads to these unprecedented volumes of children coming to our emergency room, many of those requiring admissions to our pediatric wards and to our ICU. And in order to create capacity for many of these children who are acutely ill, needing care, we had to make this difficult decision. And it's really not unique to SickKids. I think it's important to understand that there is a pressure on the pediatric healthcare system right now in all of Ontario, and to be honest, really in all of North America. That is unprecedented.
You mentioned it's not a problem or an issue unique to SickKids, and we're seeing it widespread across the province. So I want to ask you a question posed in the Globe and Mail earlier this week. Where will all the SickKids go, doctor?
We are currently working like never before collectively with our partners in the other children's hospital and with our community partners who have pediatric units to create that capacity so that the children who need care within a hospital can receive it. And I will tell you that I think we have really come together as a team like never before to make it happen and to create the capacity that's currently needed.
I know you've canceled non-urgent procedures right now. One of the priorities in the kind of aftermath of COVID was to clear the surgical backlog, or at least start on the process of clearing it, doctor. You can't do that right now. And just because something is non-urgent doesn't mean it's not needed and that families haven't been waiting a long time for these procedures. So how big of a setback is this for these families?
It's honestly heartbreaking. It's heartbreaking for the patients, for the families, And it's also morally distressing for all of us as healthcare professionals. And there's no question that this will create an even larger issue in terms of the surgical backlog that we have already been dealing with over the last 2.5 years. But we unfortunately have to focus on the here and now and ensure that every child who currently needs the care they require receives the care. And right now, that is the case.
What does the here and now look like visually, Dr. Cohn, in there? Is it mayhem? Are kids getting help or procedures done in, I guess, non-ordinary spaces where these kind of things would be being done?
No. I mean, you see obviously an incredibly crowded waiting room in front of our emergency room. There's no question about it. But the rest of the hospital does not look like mayhem. The rest of the hospital looks calm, as it always does. And we are taking these steps in order to redeploy staff, in order to create the space that we have, but that we need right now to staff in order to admit more children, either to the pediatric wards or the pediatric ICU. But it does not look like mayhem.
Something that I found quite stark as well is that your doctors, your nurses are now virtually helping kids and doctors in other hospitals remotely because there isn't space at SickKids. I want to circle back to my first question, Dr. Cohn, about the mask mandate, whether that's something you support. You said it is. I know you have Dr. Kieran Moore's ear and you have the Premier's ear. Have you communicated to them that you would like to see a mask mandate reintroduced?
I have personally, and many of my colleagues have been in ongoing discussions with all levels of Ontario Health and government about this issue and many of the other issues that we have been discussing.
And so in that same breath, is there hesitation to adopt that, to adopt your advice?
I think there are a lot of consideration going on right now with Dr. Moore and many others. So we need to wait for Monday.
And we will find out exactly what that announcement come Monday is. Certainly there is still time for changes to be made to what's coming. Dr. Ronald Cohn, thanks so much for your time and for the incredible work your staff does each and every day within the walls of SickKids.
Thank you very much, Beatrice. It means a lot that you appreciate our staff who are working so hard right now.
Absolutely. Thanks again.